everybody, Dr. Warren here with Apex Spine, Joint, and Wellness in Fayetteville, Arkansas. I want to share an interesting case with you that I see a lot, this one just a lot more severe, all right? This is a neck case that came to me from a referral. And when we look at the neck from the side, this is the base of the skull. This is the jaw, so this person is looking, if you're watching this video, towards the left. This is the cervical spine, C1, C2, 3, 4, 5, 6, 7. Notice that even though we have a 35 to 45 degree forward arcing curve towards the jaw, everything still lines up really well, okay? And we don't have any pointiness to these bones. There's no degeneration. The disc spaces look good. The facet joints on the back are not arthritic or full of arthrosis and bright white. This represents a near normal or perfect neck, okay? Now, that is what we really prefer to see, and this is what this person came in with. See, he's facing the same direction, but his neck curve is going completely opposite. You see these bones are really pointy. There's no disc spaces left, okay? And the symptoms that are associated with this are not just, of course, neck pain, shoulder pain, traps, those knots that don't go away, all sorts of things, okay? Weird neurological symptoms, all right? And this patient felt like they had a lot of pressure in their head, like it's just filling up with blood and it's not draining or fluid, and then they get this awful brain fog with them and with it and all sorts of other weird stuff because of that pressure, all right? And that is usually directly related to this. We have to remember that not only is our spinal cord contained inside of there, the blood flow going up to the brain, okay? The draining of the blood, CSF fluid coming down from the vein, or the brain, excuse me. We have a lot of stuff going back and forth right there. It's an area of a lot of things going on, all right? And so what this patient is likely suffering from is compression of maybe the internal jugular vein, compression even possibly of the carotid arteries, things that are not allowing blood to come forward and things to drain properly, all right? Now, let's back up here for a second and go from pain to neurologic function. Now, a lot of physical therapists or people who just treat pain, chiropractors that are more PT-based, that really group of providers will often say that a neck shape like this and bad posture and degeneration is not always associated with pain. And they're right. The research shows that. The research shows that you can have shifted bones, you can have degeneration, you can have degenerative discs and not have pain, okay? But what they're incorrect about is that it's not a problem, okay? This absolutely is a problem. It's a severe problem. And because there's so many neurological structures in here, we can have compromised those neurological structures. And the research also shows that. Okay, the research shows that we can compress the spinal cord and brain stem with several millimeters of pressure. We can decrease blood flow. A colleague and a really good friend of mine, Dr. Evan Katz, has done a study on this, that when we are in the correct position in our neck, we have more blood flow going up and down from our brain. There's a chiropractor in New York who studies very extensively that the CSF flow up and down when we're in the correct lordotic position and the top bones are aligned right, that the CSF flow, the fluid that nourishes everything inside of there, is flowing correctly, okay? So we can't just concern ourselves with pain, all right? Because sometimes, again, like mentioned before, this may not always be associated with pain. It may also be associated with other neurological things. So what did we decide to do with this patient? And, well, let me mention one more thing, too, here real quick. That's quite important, all right? When a neck is like this and it's not moving well and it's not going into extension well because it's so flexed, these top structures, C1 and C2, take way more of a burden and of a load. And as that goes forward, as your head juts forward, okay, what happens is the suboccipital muscles, the ligaments, all of these soft structures up there get more of this load on there. And then it can become unstable, all right? We don't want instability up here because it can cause also a lot of weird neurological type symptoms. But these patients, the most common symptoms they present with is headaches, occipital pain, shoulder pain coming down from the neck and the trap and the rhomboids and the levator scap. All right. Like I said, occipital headaches, migraines, brain fog, all sorts of weird stuff from this right here. All right. Now, whenever I see a neck like this and I dive more into the history, this person really didn't think they had a lot of trauma. Went over and over and over. Are you sure you didn't have any trauma? I mean, this is really bad, and this is for not having any head injuries. And then we thought and thought and thought, and I investigated, and come to find out, he actually worked as, I believe, like a sheetrock guy or drywall guy or something, or some type of manual labor, and for years he was carrying heavy things on his head. So his body kind of compensated, and he had a lot of sped up degeneration and issues because of that. Okay? So I believe that's the root cause of this, because he hadn't been in any car accidents, hadn't had any head injuries, so on and so forth. Just repetitive stress and trauma from carrying something heavy on his head all the time. Okay? Now, I always am concerned with instability up top with things like that, so I also shot another x-ray to look inside. What we do is we open the mouth and we shoot inside and have them do some movement to determine if that top bone starts to slide off. And it should slide off a little bit, but not completely hang off. There's an accepted range, and that accepted range is anything 3 millimeters or below is accepted. Anything over that is considered instability. And this is a static image, mind you, meaning it's just you know, you're not watching the movement live. And so we know that if we take one picture and we see instability, that if we were to watch it live, it would be much worse because we're capturing the full movement. Okay, so after measuring this guy's overhang of this bone right here, this point overhanging this point, we notice that he's past that threshold over 3 millimeters. So he also has instability. All right, and we see this a lot in car accidents, and most chiropractors don't even check for it, don't think to check for it, and don't take the time to do that. All right, we always look at this because these are things that can be considered permanent injuries. All right, because ligaments and tendons don't tend to heal very well or on their own, so on and so forth. All right, so what we did is I wanted to see if his spine even had the ability to go back into extension. And so what I did is we took what's called like a stress x-ray, and we had him take a band, pull this forward, and then lean back to see if those bones even start to move back or go into extension or go back into lordosis, is what it's called. And we notice that when we do that, all of his extension comes from up here, and yes, he comes back to being perfectly straight, but he still doesn't have some lordosis here. So we're going to have to really work on the extension part of his neck to relieve these symptoms over time, to get his neck in a better position, to prevent surgery, and to help relieve these neurological issues. So very interesting case. One thing too is this patient went to every doctor you can imagine, everyone on the list, PT, surgeons, medical doctors, other chiropractors, and like nobody just looked at his neck, related his symptoms, and took his history. It was actually quite simple of what was going on. Now, if these things get and stay extreme and they don't get better, sometimes we will do or order what is called a CT angiogram. And a CT angiogram is where we look at the blood flow inside all of that to see if things are flowing properly, or if there's any backup, or things are compressed in the neck from these structures and so on and so forth, if things don't get resolved. So trying some conservative care with some corrective type exercises. We've also talked about diet in this, because healing is very, very important with sleep and diet, as well as adjustments to the middle of the neck to help move these facet joints and help him be able to go into extension. And we just do a little what's called trial run, and we see if did that make a difference, did that improve quality of life, and then we either keep going or unfortunately we make a referral. So We want to try to avoid surgery for this patient at all costs. But this is a very, very tough case. So in this case, we just do a little trial run. So very interesting. It's stuff that we can help with, but it's things like this that just take a more of a look, more of an in-depth and more of a background knowledge and education and really good look at things like this, because that's what generates results. And that's what I'm known for. If you come to see me, we're going to get results. And if it's something that I can't get results with, it's not something that we're going to do in the office. I know that sounds kind of harsh, but that's what's important to me, is getting patients results. So it takes time and it takes a really in-depth look to be able to do so. So very interesting case I wanted to share. Hope you appreciate that. If you have any questions about any of that, always shoot us a message, shoot us a text, come in for a free consult and see if there's something going on with you that may be related to the neck, may be related to something inside here that you didn't realize, and have it checked out, and we can get an answer for you. Have a great rest of your day.